Hi students, today we are moving on to the topic of MSW third semester specialization, that is medical and psychiatric social worker. Our first subject is clinical assessment and diagnosis of psychiatric disorders. Before moving on to the modules, we want to know some of the terms and conditions that we want to aware about it. So first of all, we moving on to the what do you mean by psychology? The word psychology comes from the Greek word psych meaning breath, spirit, soul, and the Greek word logia meaning the study of something. Psych meaning soul and logia meaning the study of something. That means it is a study of soul or it is a study of mind. According to William Wundt, it is a study of consciousness. Psychology is the science which aims to give us better understanding and control of the behavior of the organism as a whole, according to William McDougall. Then what is abnormal psychology? It is a branch of psychology devoted to the study of classification, etiology, diagnosis, treatment and prevention of mental disorders and disabilities. We know that it is a scientific study of mental disorders and their treatment. Then, who is a psychologist? A psychologist studies about patient and they test their disorders, talks and counsels. And the psychiatrist work inside a branch of medicine dealing with psychological disorders. Psychiatrists can provide medical treatment for the mental illness persons. Then who is a clinical psychologist? A specialist training in psychological assessment and therapy with diagnosed psychiatric or mental disorders. Clinical psychologist is a person who has specialist training in psychological assessment and therapy with diagnosed psychiatric or mental disorders. Then we can know that who is a psychiatric social worker. A psychiatric social workers typically conduct interviews in order to determine the appropriate services to offer mental health patients and their families. They develop care plans that include counseling, support services, treatment methods and referrals, as well as periodically review their patient and patient family situations and make changes to the care plans as necessary. The psychiatric social worker not only gives services and treatment to the patients but also to their family members as their need. Typical job duties include explaining treatment plans to patients and their families, maintaining patient records, preparing reports, monitoring progress toward treatment goals, and conducting annual reviews of active treatment plans. Psychiatric social workers may also offer individual and group therapy sessions to patients, instruct other mental health staff in therapeutic techniques, provide crisis interventions, arrange for services from referral agencies, and help patients ease back into the community after leaving inpatient programs. The psychiatric social workers cannot prescribe medications. Here, the psychiatric social worker's role is to treat the mental patient and also, if they necessary, they are moving on to their family situations and provide better therapy sessions for the patient and their community if they want it. The next one is clinical social worker. Mainly, the clinical social worker focuses on the assessment, diagnosis, treatment and prevention of mental illness, emotional and other behavior disturbances. Individual, group and family therapy are common treatment modalities. Individual, group and family therapies are the common treatment modalities. But the clinical social workers cannot prescribe medicine for their patients. Next, we move on to the module. What is psychiatry? The term psychiatry was first coined by the German physician Johann Christian Reid in 1808. We know that psychiatry is the medical treatment of the soul. It is the branch of medicine dealing with mental disorders and its treatment. Psych meaning soul and atry meaning medical treatment. So, psychiatry means medical treatment of the soul. Then we are moving on to the history of the psychiatry. First of all, prehistory. In the prehistory, the only evidence of medical activities in the prehistorical time is archaeological. That means skulls estimated to 5,000 to 10,000 years old have been recovered bearing the marks of trepanning cutting through the skull of a living person. This has been recovered from several parts of the world, that is Africa, France, Asia and America. It is believed that the holes bored in the patient's skulls were meant to let out the evil spirits. They believed that spirits causing the illness would escape through these openings. So, in prehistorical time, the main thing that they do on the mental patients is they will trepan the skull. Next one is temples of healing. In temples of healing, more than 1,000 years before Christ, the shamans were placed by priests who played the varied roles of priest, magician, physician and psychologist. Shaman means a wooden statue. Shaman is the medicine man bestowed with the power of entering the realm of spirits and through whom the spirits communicate with human beings. During this process, the shaman becomes excited to the accompaniment of drum beats and rhythmic music dances and feigns to enter the world of spirits. Patients were also made to actively participate in the ceremony. The witch doctor at work. The witch doctor was a medium through whom the spirits spoke. He prescribed ways to appease the spirits through prayers, incantations and herbal concoctions which were shared by all the participants of the ceremony. The sick people flocked to the temples and were reportedly cured for their ailments. The temples called Asclesia were subsequently modified as elaborate institutions. The belief was that auspicious would visit them in their sleep and cure them. The whole process was called incubations and this was supplemented with recreational activities like walking and soothing music and the patients were treated kindly by the priest. Next one is Age of Rationalism. In Age of Rationalism, the Hippocrates, who is the father of modern medicine, his theory explained that illness resulted from disequilibrium of the four humors as against demonical influences. That is, brain as the organ of intellectual activity and attributed mental illness to its pathology. For him, medicine was a profession, science and art. The goal of the treatment was to assist nature, first by diet and later, if needed, by drugs. He denied the demonical invasions and instead emphasized natural causes for diseases and relied on clinical observation. He maintained that mental diseases were due to brain pathology and classified them into mania, melancholia and phrenitis. Then we move on to the Dark Ages, that is 500 to 1000 AD. In the Dark Ages, medicines and other scientific pursuits were eclipsed in Europe by demonology and witchcraft. It was a period of great social upheaval and intellectual stagnation. In this period, the burning of witches. By the end of Middle Ages and for the next few centuries, mental patients in Europe were convicted of witchcraft in accordance with precepts laid down by two monks appointed as the inquisitors by the Pope. The sure proof of witchcraft was the patient's confession, which was inevitably obtained through torture. Witches were burnt alive or beheaded, mutilated and dismembered and then burnt. In spite of these brilliant sparks, the period between 500 and 1000 AD was an age of mental and intellectual stagnations. Then we move on to the age of witch hunting. Anything abnormal or which upset the normal fabric of behavior was the work of Satan and act against God. Therefore, it is punishable. In age of witch hunting period, there is a water test going on there. That is, the witch hunting was a regular practice in Europe in the 15th and 16th centuries. Those who were suspected to be possessed or in a league with witches were thrown into water after their hands and feet were tied together. If they floated or swam across, they were judged to be witches and hanged. If they drowned, they were declared innocent. So, in the age of witch hunting, this was the practices going on there. Next, we move on to the topic psychopathology. What do you mean by psychopathology? The scientific discipline of psychopathology was founded by Karl Jaspers in 1913. Pathology means the study of nature of disease. Psychopathology is the study of mental disorders. So, we can move on to the what are the signs and symptoms of psychopathology. We know that the psychopathology is the study of mental disorders. So, what are the signs of the mental disorders? First one is changes in eating habits, changes in mood, excessive worry, anxiety or fear, feeling of distress, inability to concentrate, irritability or anger, low energy or feeling of fatigue, sleep disruptions, thoughts of self-harm or suicide, trouble coping with daily life, withdrawal from activities and friends. These are the main signs and symptoms of psychopathology. Then next is traditional and modern attitude of psychiatric illness. By discussing about the traditional and modern attitude of psychiatric illness, we can see that in traditional, all are seeing mental illness as evil spirits, something doing that, or it is a performance of a Satan or evil spirit. But in modern attitude of psychiatric illness means it is a disease and it can be treated and it can be cured by medicines or by support or the care of psychiatric or social worker or by counseling. So there is a difference between the modern attitude and traditional attitude of psychiatric illness. So in modern and traditional attitude of psychiatric illness, from the history of psychiatry also we can know that there is a misunderstanding of the mental illness. Before the Hippocrates do something about the treatment of the mental illness, they are telling that the psychiatric illness or mental illness is a performance of a Satan or evil spirits or something or more. But today we can see that it can be treated, it can be counseled and supported by therapies, medications and pharmacology and all of that. So psychiatry is not a performance of a Satan or evil spirits. It is a disease and it can be controllable and it can be treated. Thank you.